The announcement by President Trump on the withdrawal of aid, particularly through USAID on matters health, is a national crisis which must be addressed quickly. In Makueni alone, we have 269 workers who will lose their jobs immediately, because beginning end of last month, they are all supposed to be home, and they are catering on very serious issues on TB, HIV, and malaria. Although malaria is not a big concern for Makueni, but TB and HIV are issues of concern for us. Although we received an assurance that Kenya has stock for antiretroviral drugs for the next 15 months, we still have no plan, a transitional plan, for how, after the 15 months, what is going to happen. A huge population in all these counties is dependent on these drugs. And I am extremely worried that in the absence of those drugs, we're going to start losing people. The stigma that had gone away will come back. And more importantly for me, and because of the statistics I have seen in Makueni, teenage infections between the age of 24 and 35 have increased tremendously. And therefore, this admission of these drugs, the continuous counseling, because that is part of the team, is very critical. The Council of Governors have had a discussion, and I hope that that discussion can be fast-tracked very quickly to national level, because 54,000 Kenyans are going to lose jobs. And a host of hospitals, some in Makueni, will most likely close because they are losing up to 10 members of staff or nurses that were under the American program. I have seen serious protests in the US today by both Republicans and Democrats on matters USAID. Those Republicans and Democrats, senators, are saying that they are the ones to dictate how their taxes should be spent. And if, like one of the Republicans who has mentioned that she was a refugee and was a beneficiary of USAID, I mean, if they are saying that, we should speak even louder and say that it is against human rights to withdraw such services without notice. We don't know what we're supposed to do. And strictly speaking, it's not because we wanted, they were helping. And I think that the national government ought to find a method, a diplomatic method with the President of America and the American administration to have a transition. That transition will save lives. And that transition will give us an opportunity as a country to find another method. I disagree entirely with President Uhuru Kenyatta, because if that was his thought when he was president of Kenya, he should have said so when he was president. He can't say so when he's out of office. And he left us with all these deals. These deals were done when he was in office. And therefore, he can't laugh at us, because I think the president was laughing at us. And he was laughing at people he used to serve. The people who are being assisted and are alive because of the antiretroviral drug since 1990. We can't laugh at them, and I've seen them. So this is a matter of concern. Health is a big issue, and I think that as a nation, we must come together, close ranks beyond our little parochial politics, and discuss the matters of health.